Good day. I am LM Canabi Campo from Foundation University Dumaguete, a Level 2 nursing student. And today, I am going to perform administering parenteral medication, which is the intradermal injection. Now that we know about it, let's actually do it. Wash your hands, provide privacy, verify patient with name and the date of birth, do our 3 checks, and our 6 rights. Our 6 rights are right patient, right medication, right dose, right time, right route, and right documentation. Now we're ready to draw up our ID injection. Remember when we were dealing with the vial, we have to check for the expiration date, the lot number, and the manufacturer. This is a tuberculin syringe. This is a very little syringe. This whole thing is 1 ml. So for comparison purposes, this is a 3 ml syringe. So this whole thing is the equivalent of just this little bit in this syringe. So this does not hold a lot of fluid. This is not made to hold a lot of fluid. So this is the 1 ml syringe. So this is a vial. This is not actually really real medication. It's just for pretend for demonstration purposes. So let's just pretend it's a vaccine. Now, we're ready to do our intradermal injection. So we're going to pop off the cup, alcohol wipe, and we're going to draw back our air, and the amount of air we draw back is the amount of fluid we're going to take out the vial. So let's say for pretend it's 0.3. So we're going to pull back to the point 0.3 of air. We're going to inject that, and then we're going to flip it upside down and pull back 0.3. of the fluid. And it's best to do this at eye level and make sure we're at the right place. So here we are, 0.3 ml. Now, we're ready to inject this into the patient. And now, I am going to administer intradermal injection to the patient. And after you enter the room, introduce yourself to the patient. Good morning, ma'am. I am LM Canabi Campo from Foundation University Dumaguete, and I will be your nurse for today. So today, ma'am, I'm going to administer intradermal injection. Is that okay for you, ma'am?
Yes.
May I ask your name, ma'am? Your name, ma'am?
My name is Mercy B. Campo.
Date of birth, ma'am?
December 12, 1967.
Now, we're ready to do our intradermal injection. So to find the location, you're going to go 1, 2, 3, 4. 4 fingers down on the forearm, making sure that the patient's arm is flat and resting on a surface like a table. Then about this point,
You're gonna wipe it. You're gonna wipe it. Wait for it to dry. Don't blow on it or don't wave your hand over it. Just wait it to dry. Then we're gonna take our syringe with our bevel up and we're ready to inject. So in my procedures, I'm not gonna use needle. So as you can see, but I'm gonna show you on how to properly position it to its right angle. So now we're ready to inject it. Remember, just barely above the surface, 5 degree to 15 degree angle, okay? Slowly. And then cover it. And then don't massage it. Now we are all done.
And after that, do the aftercare and hand washing. And remember to document the procedures. So that's how you administer parenteral medication, which is the intradermal injection. So that's all for today. Thank you. Keep safe everyone and God bless.